It's looking at your MRI.
Okay.
And here, well, first of all, there's a couple things. One is there was motion during the test. And motion makes the image blurry. So that's not a perfect study. So that's a little bit of a problem if we're going to operate. That's number one. Number two, you do have something at 4.5 and at 6.7. 4.5 looks pretty like what you see every day in people with spinal stenosis. Not too unusual. 6.7 is a little bit more unusual as the disc comes down and it goes behind the vertebral body. It's sort of wrapped around the spinal cord.
Okay.
Which is not typical.
Okay.
So we put a call into the radiologist to try to understand why that looks that way. And then the way to think of it is if I had those balloons, the ones the guys make the hats, they're pretty soft. And the spinal cord is in a sac that's fluid filled and soft like that. So when you push against it, the spinal cord just flattens out normally. But the material doesn't wrap around it like this. It doesn't form like that around it. Usually it sits this way, kind of straight across, or pushes on this side and this side. It doesn't. This is perfectly conformed. So that doesn't make sense to me. So that's another factor.
So you can have them retake those 2 MRIs?
Well, we can have them redo those images to make sure that we're seeing clearly on all the cuts, right?
Okay.
And the last thing is that your kidney function is not so great.
Yeah, it's not.
Yeah, and I think the thing is, if we were to do surgery, the surgery that would be required, if that is a disc, would require us to remove part of the vertebral body, the bone, to free up the spinal cord, and it probably will send you into renal failure, which means dialysis.
Right.
So,
Can I ask a
you
question?
can ask me as you like.
If that's the case, can you put the port in her arm while she's under for this surgery?
No, they usually put the...
Can I put the port in for dialysis?
Yeah,
I
because
don't-
they
I
are
don't
where
do-
they were. Oh, you don't do that.
No, I don't do that. But
Okay.
I mean, is it possible? It might be possible, but I'm just saying. So all those things are factors, right?
Right.
So it's just trying to figure out, get a better handle on what we're seeing, and then once we understand that, then we can tell you more. But I think it's a more sizable operation, and I just worry, given all your health issues, how it's going to go. But that's kind of where we're at right at this minute.
Okay.
Does that make sense?
Yeah. It does
Is
too.
so in your professional opinion, it needs to be done.
That's not what I said.
Oh.
That's not what I said.
No, I'm just trying to.
Yeah, so what the summary right now is that we see things in her spine, some of which could explain some of her symptoms, but it's not what I would call textbook, meaning that, normally for this set of problems, you see this picture on the MRI. It's not lining up like that. The other thing is that when you do these operations for these kinds of problems, what they say is the best result you get is to stay where you are. So you don't necessarily get improvement. So when you start talking about subjecting someone to an operation where you're not going to get improvement,
Right.
it's not to say that it never happens, it's just to say that more often than not, you're just kind of maintaining the status quo and trying to prevent deterioration, getting worse.
And if after you look at the films, if we do nothing, this will just get worse, right?
Well, so if that is the problem, if that is indeed the problem, and there's no other problem, there is a chance that it can get worse over time.
Okay.
And the question is that weeks or months, or is that years? And the answer is don't know. I know if you fall and hit your head, that can be a problem because what that does is can jam that disc against the spinal cord and create an event and give you paralysis. So that's all part of the decision making, but it's just trying to explain that, even if we operate, you're not going to get better. We're just trying to prevent you from getting worse.
Well, I guess where we're confused is we were told operation is a must, not it's an option. And so now
Well-
you're saying it's an option.
What I'm saying is, I'm just giving you the facts. And the first fact is, yes, you have something. Yes, it could require an operation. And if it requires an operation, the best outcome is to stay where you are today.
Mm-hmm.
That's what that's.
It's not going to make you better.
It's not going to make you
improve it,
better.
And also risk renal failure.
Yes. Yes.
Is
So I'm just saying that's just the starting point. And I'm
Yeah.
saying we've got to get some more information.
Okay,
So we're trying to get some more information so I can tell you, yeah, this is more likely a disc or more likely something else by doing a few additional studies. But that's the baseline is if you get an operation and there's some things that could be operated on just based on the pictures, right? Then the best you can hope for is staying the same. So that's, and you may end up in renal failure. So I'm just kind of laying the cards out there. Does that make sense?
Yeah.
to an
That's good,
extent,
too.
but I guess my biggest concern is the prognosis. Whether she stays the same with or without the surgery, will she need 24-hour care going forward? Will she be able to walk on her own?
Well, here's the thing. If she stays the same, so let's say we operate
Yeah,
and everything goes perfect
yeah,
and she's just like she is now.
right.
Whatever her care she requires now, she'll require in the future.
So, okay.
So do you understand what I'm saying? So
Yeah.
it's not like I can say, well, oh yeah, if I go in and I take the disc out and I do this, that she's going to miraculously be better.
Right.
Now, there's a small subset of people that do get better, right? But if you took 100 people, that's only going to be 10 of those people.
Right.
90 of them are going to be the same.
Right.
And so you don't want to tell people, oh yeah, you're going to get better, and then you're all upset because you didn't get better, when the evidence says, hey, most of the people are the same and we're trying to prevent you from getting worse. That's what we're saying. That's
so
what
when
I'm
you get
saying.
these additional studies done that you need, whatever they are,
Yeah.
do you then make a decision whether it's absolutely necessary or it's okay?
Well, I mean, absolute is relative, right? So, and what I mean by that is, the first thing is to try to figure out if indeed this is what's causing your problem, right? Which is your balance. And so of the things that in the spine that can cause balance problems, you have some, right? Herniated disc can cause balance problems. But typically they cause other things like other reflexes to be abnormal or other sensory changes to happen or other things, other kinds of weakness. You don't have any of those. So all I have is a balance problem over here, and I have some spine pictures that say something's pinched. What I don't know for sure is this balance problem really being caused by this? Now we've eliminated a few things. We looked at the brain, but it doesn't mean that we've eliminated everything. So if the balance problem is not caused by the spine at all, and it's just you had this problem and it was like this a year ago and 2 years ago and 5 years ago, and you just didn't know it, then the operation will be of no benefit to you.
Okay.
Do you follow what I'm saying? So your picture's a little bit complicated, and so we're trying to get the information to make it a little less complicated, but that's kind of the big picture.
Okay.
So,
Now, when you say you need a clearer picture from the
Yeah.
MRIs, is that something that they can adjust with what they have already? Or
no, well,
you have
it's
to get another MRI?
no. She's going to need another MRI, and the way to think of it is, it's like still photography. I take your picture, but you're moving around, you get a
Right.
blurry image.
Okay.
So she's in the machine and she's moving a little bit. And the thing is, when I say moving, I'm talking like this. That much movement is enough to mess up the MRI. I mean, I've done it myself, and they're like, you're moving, and you're twitching your face because it's itching. You can't scratch it, and that's enough movement to make the MRI blurry. So it's not something that a person is doing willfully. It's just that small amounts of motion matter because of the way the test is done.
So, what would you need to see on these MRIs to make it beneficial to have a surgery? Because it sounds to me like if you do the surgery or not, she's in the same exact spot. What would make you say surgery is probably necessary to benefit her in some kind of way?
Well, I mean, first thing I want to do is see whether that lesion, that thing that's wrapped around the spinal cord, is really, if I can really tell whether that's disc or something else.
Okay.
Because if once I understand that, so let's say that it is disc and it's pushed and it's stuck on the spinal cord, then that means you got to try to peel that off. And to peel that off is, high risk.
Okay.
It's not insignificant. And because the problem is that if it's stuck, so think if I took some crazy glue and I stuck something, a blob of gum, to that balloon, and now I want to peel that blob of gum off the balloon, I have a chance to rip a hole in the balloon.
Right.
No
You
matter
better
how
leave it.
careful I am.
Right.
So I'm just saying, it's just a lot of issues here, and so what I'm trying to do is to eliminate some of the issues, understand them a little bit better, give you as much information early, so you can kind of just think about it, right? Because I mean, ultimately, you got to decide, and depending on what the radiologist helps us understand what that is. I mean, if it's something more unusual, and he goes, "Well, I don't really know what that is," we may need to do a different kind of test to get even a better understanding. I don't know for sure if that's going to be necessary.
Do you know what else it could possibly be? Do you have ideas of what it could be?
Yeah, it could be a lot of different things. It's just not clear. I mean, I just don't. And the reason it's not clear is because of the shape and configuration. I've never seen a disc do that, and I've been doing it for 20 years. So there's a lot of MRIs I've looked at over time. It's not to say that we always see things that are new and unusual. It's just to say that it's just like my spidey sense goes, that's not what you normally see. So that's why we want to take the time to be cautious.
And I like that.
Yeah, well, yeah. And then if it comes back and it's still something you can't tell, do you consult with other surgeons that might?
Yeah, we could. I mean, we could. The other option would be to have you go to the university, which might be a good option.
Okay.
If we can't figure it out, we can't get resolution. And the reason to do that is because then what you do is you probably do have either a combined procedure with neuro. So if you get in there and you have to peel it off, and let's say you have to take out a chunk of the balloon that's, say, that big, now you got the spinal cord exposed, and you either got to repair it or you got to do this dural patch, which they are used to doing because they do the brain stuff. It just depends on how extensive it appears. So that's why we're just trying to get as much information, so that if we do have to have you go to the university, at least we have, you won't have to do a lot of additional testing, hopefully, because they'll have an idea like, okay, this is what's wrong, this is how we can treat it, and then it's just the question: will it be a smooth ride or will it be rocky? The answer is it could be either.
Okay.
Is that helpful?
Why you got clear on a lot of it?
Yeah.
Does that make sense to you or not make
It
sense?
does make sense to me. I mean, I would prefer that you dig further and make sure it's absolutely necessary before we do it.
Yeah, I mean, the thing is, we don't want you falling, right? So we like to minimize that risk. So whatever can be done to minimize that is going to be helpful regardless, right? Because falling and hitting your head when you're older is not good. Falling and hitting your head when you're younger is not good either, but falling and hitting your head is not good. So that we want to try to do regardless. And it's a little bit unusual because most people who have their spinal cord, when it's pushed, they have balance problems, but it's not standing. They can't stand up fine. It's when they get in motion that they have trouble. And so the fact that you can't stand up and you feel like you're going to fall backwards, that's also unusual. Have you had much trouble with double vision?
I just started having some double vision.
Yeah.
When did that start?
It actually started when I came here.
When were you having it all before?
At times, but not all the time.
And was the double vision at all correlated with or tied or linked to,
The fall?
yeah,
No.
that you're aware of?
Mm.
Yeah, because double vision doesn't go with this at all. And so then you say, well, okay, why would a person have double vision and how would that tie into this? So there's some things that just, it's like, well, that's sitting out here in the universe and we don't have it linked to anything at the moment. But we know double vision can cause balance problems.
Right.
And it takes is a split second,
Yeah.
Because if you look and the room does this for a second, your body reacts and then boom, you're on your way.
Yeah.
And when you get older, the thing is you can't recover. Your reflexes aren't fast enough. Do you have any other questions?
I guess not until we get the other MRI. Is
Yeah.
there a way to strap her down so she doesn't move a little bit?
You have to ask them. I don't know.
Because she has high anxiety for the MRI, and they do loop
Yeah,
her
I
up with
understand.
medications.
I understand all of that.
Yeah, so she didn't even remember going in for the MRI, let alone
The first
telling her.
one.
Yeah.
I
Right.
remember the second
But I mean,
Okay.
it's even in people without anxiety, right? They move in MRIs.
Yeah.
It's not purposeful. So I'm just saying, the fact that you have anxiety is neither here nor there. The fact is that people just move,
Yeah.
and so the objective is to minimize the movement. However, whether that's medication, anesthesia, whatever. Okay.
Okay.
So that's kind of where we're at. If we hear something from the radiologist, we'll let you know. They're not in the hospital yet.
Okay.
So she'll be going for the MRI today.
I don't know.
Kathy will probably order that
I
if
mean,
it's
I don't.
here.
I mean, I don't know. I mean, I have no idea what
Yeah, I'll be keeping in touch with you.
Okay.
what the schedule is, or I don't know.
Okay.
Okay.
Thank you.
Any other questions?
Not that I can think of.
Okay.
Thank you. There's a lot of risk reward.
So do you want to kind of like paraphrase what you understood from that, and I can try and add?
Well, what I understood was he's not sure if the surgery would benefit her in any kind of way, with not knowing what's wrapped around her spine. What I don't understand is what else it could be, but he didn't really want to say what else it could be.
Well, first of all, the area that he's looking at doesn't even necessarily explain the problems that she has. So it could be anything from, and that's even if we figure out what it is, it's still not may not explain the picture. But it could be anything from not a good image to some kind of unusual disc injury to some kind of benign mass, all the way to like a mole pit.
Right, and that's
Could be
what.
anything on that line.
Yeah, I guess that's my biggest fear. Is that's what it could be, considering she's had the.
Based on the way he described it, if it's unusual for the disc to literally start growing around the spinal cord, then it's got to be something else.
And he said that surgery is extensive, bad, if they have to go into the spinal cord one.
So, I mean, is he basically saying unless it's a melanoma of some sort, he's probably not going to go in there and mess with anything?
No, that's not what he's
I
saying.
think he's not even really making a decision yet.
Yeah.
We don't have enough.
He doesn't have enough information to even make any determination.
That's
But what she's got to consider, even
And
no
if
matter
it,
what they find, is whether to her it's worth the risk.
Mm-hmm.
With the fact that she's going to be more than likely going to be on dialysis the rest of her life, or if it's like he said, if they do it and she's not going to be any better.
Right. So you'll
Is it worth
You'll need-
risking
need care, Mom, is what he's saying.
that? Either way.
Yeah, you're going to need care when you leave the hospital.
either way,
Yeah.
and that care, I personally think the care after surgery, obviously we need to find out more about exactly what surgery it would entail. The
Mhm.
care would be a lot more.
Right.
Because after the surgery, you're going to be in pain, you're going to be laying around in bed for a very long time. The muscles that you do have that are working are going to
Mm-hmm. And that's going to be on top of dialysis 3 times a week. Lot to think about. Are you okay, Mom?
Yeah, I'm fine.
Right, well, let's just wait and see what
What he
they can
comes
get
back
you
with,
another
yeah.
get in there and see if they can get any more information.
So will Dr. Burke be coming back in here, or is she just going to...
She has office hours today, doesn't she?
She does. I usually meet with her a second time around lunchtime,
Okay.
and then I imagine. You guys can hear.
So if Dr. Payne talks to her, she may not. She may wait till tomorrow morning.
But do you think she'll request this MRI right away?
Don't know.
I don't know. Maybe
Oh,
ask
that's...
her. I'll
Okay.
ask her.
Okay.
I say any day you wake up on this side of the grass, you're doing good.
I will be here all day. So if
Okay.
Dr. Burke's around, yeah.
Well, if you're here, I'll make sure.
Okay.
And I know Dr. Burke is kind of questioning whether we even have the resources. especially since what we're seeing doesn't necessarily explain the whole picture.
Right. So when he talks about going to the university, he's talking about University of Chicago? Okay. And that's where all the experts are. Yeah.
So I'll catch up with you in about 2 hours.
All right, sounds good. Thank you.
Thank you.